Hi everyone, I'm Dr. Lynn Wagner of Wagner Integrative Health, and this is Doc's Thoughts. So I want to share my experience today of being a patient. So about a month ago, I noticed that I was getting kind of bloated in my belly, and I was like, this just doesn't seem right. So I laid down on bed and started to kind of self-examine myself because I'm a doctor, so I kind of know what to look for. And I felt a mass. I felt a mass kind of lower in my pelvis. So as you can imagine, my mind went to all the bad things, and I kind of freaked out in a reasonable way. The next day I texted my friend who's a gynecologist, and she scheduled me for an ultrasound and a visit with her immediately after, but it was several weeks later. So I had a couple weeks of just really not knowing what was going on in there. And if you know, there's lots of different things that can happen in the pelvic region, from ovarian cysts to fibroids to adenomyosis to bad, scary things like cancer. But the 2 weeks went by and I had my appointment, and I was, getting my ultrasound, and I see this huge black thing on the screen that I knew wasn't supposed to be there. But luckily I saw the doctor right after, and she said, as long as your cancer marker is negative, we're 99% sure that this is just a benign cyst. So I felt pretty good about that. And then 24 hours later, I got the negative cancer marker. And so I felt really, really good about that. So fast forward to a couple days ago, I had my surgery. And the whole experience was surreal, from driving up to the hospital, going to registration, getting my wristband put on, getting put into the pre-op room, getting all the electrodes put on me, getting my IV placed, and then ultimately getting wheeled back into the OR, into that whole cold room with bright lights and people in all their surgical gear and all the instruments getting counted and gauzes getting checked. And I feel like I'm a pretty stoic person, but it's still really scary. And it always, every time I'm a patient, and I've been a patient multiple times, but every time I'm a patient, it both humbles me and gives me empathy for how we all experience the healthcare system. It humbles me because I realize that, the Western medical system, although I bash on it quite a bit because it's very, very broken, is also a very, very important part of all of our lives. And that's one thing. And then also, seeing what patients go through when they go through these health experiences, I think is really, really important, because as providers, we have to get a little bit hardened and we have to get a little bit cold. Otherwise, we wouldn't be able to do our jobs. But we also need to continue to have empathy and really understand what patients are going through when they're suffering, when they have pain, when they have scary times, all those things. And all those things will happen to all of us. And so as providers, we need to really maintain our empathy for that, while also being able to have a little bit of a boundary so that we can keep doing the job that we're doing. My whole point of this story isn't for you guys to be like, oh, Dr. Wagner, hope you're feeling well. My whole point is that we can't throw the baby out with the bathwater. Western medicine is very, very important. And I will continue to highlight the bad stuff about Western medicine as well, because we need to transform it. But the answer isn't to throw it away. What I see with a lot of alternative and different providers who are providing different forms of healthcare and well-being and wellness programs is that they consistently bash the Western medical system, and they tell their clients and their patients not to use Western medicine at all. And that is not the way to do it, because we need Western medicine. If your appendix is bursting, you need an OR. If you have a big cyst like I did, you need an OR. If you have a bad infection and an antibiotic is the only way to take care of it, you need an antibiotic. And so my goal with integrative medicine, and what I try to do with my practice, and what I'm trying to preach on various social media channels when I do things like Doc's Thoughts, is how do we transform the system? How do we elevate it? How do we incorporate all these beautiful forms of alternative healing that are out there that are also very powerful, while not dismissing the depth of knowledge that we have in Western medicine? I don't know how it's gonna look, but that's my goal, and I would hope that you would continue with me on that journey. So we'll talk to you guys soon. Let me know your thoughts.